The real science behind historical plagues. Imagine a world ravaged by invisible enemies, where death stalks every street and shadows every home. This isn't fiction, it's history. We're diving into the science behind history's most devastating plagues, from the Black Death to the Spanish flu, revealing the microscopic horrors that shaped our world. The Black Death, a name synonymous with devastation, swept through Europe in the 14th century. It wiped out an estimated 30 to 60% of the continent's population. But what caused this catastrophe? The culprit was Yersinia pestis, a bacterium responsible for the bubonic, septicemic, and pneumonic plagues. This deadly bacterium didn't act alone. It relied on a tiny accomplice, the oriental rat flea, Xenopsilla chiopus. These fleas, thriving on black rats, acted as vectors, transmitting the bacteria to humans. The rats, common in medieval cities, provided the perfect reservoir for the disease, and sanitary conditions were rampant. Garbage piled high, and sewage flowed freely, creating a breeding ground for rats and fleas. Dense populations in urban centers further fueled the spread. The close proximity of people allowed the disease to jump from person to person with ease. Global trade routes, the arteries of commerce, became highways for the plague. Ships carrying goods also carried infected rats and fleas, spreading the disease to new lands. The Black Death left an indelible mark on European society, causing economic collapse, social upheaval, and religious questioning. Fast forward to the early 20th century, and the world faced another deadly pandemic, the Spanish flu. This time, the enemy was the H1N1 influenza virus. It spread with alarming speed, infecting an estimated 500 million people worldwide. Unlike the Black Death, the Spanish flu was transmitted through the air. Respiratory droplets, expelled when people coughed or sneezed, carried the virus. The virus's high mutation rate made it particularly dangerous. It constantly evolved, evading the immune system and making it difficult to develop effective treatments. At the time, there were no effective vaccines or antiviral medications to combat the virus. This lack of treatment contributed to the high mortality rate. The Spanish flu disproportionately affected young adults, a demographic typically resistant to influenza. This unusual pattern baffled scientists and remains a subject of ongoing research. The reasons for this remain an area of active scientific investigation. These historical plagues highlight fundamental epidemiological principles that govern disease spread. Population density plays a crucial role. Densely populated areas provide more opportunities for pathogens to jump from host to host. Sanitation and hygiene are also critical factors. Proper sanitation reduces the breeding grounds for disease vectors and minimizes exposure to pathogens. Access to clean water is essential for maintaining hygiene and preventing waterborne diseases. Nutritional status also impacts susceptibility to disease. Malnourished individuals have weakened immune systems, making them more vulnerable to infection. Herd immunity, a concept often discussed today, also played a role in historical outbreaks. Herd immunity occurs when a large proportion of a population becomes immune to a disease, either through vaccination or prior infection. This immunity protects those who are not immune, slowing or stopping the spread of the disease. Historical outbreaks provide evidence of herd immunity developing over time as populations gained resistance. Modern science has provided us with powerful tools to understand and combat infectious diseases. DNA analysis of ancient remains allows us to identify pathogens and trace their evolution. This analysis reveals insights into pathogen virulence and transmission mechanisms. Disease surveillance systems are crucial for detecting and monitoring emerging outbreaks. These systems allow us to identify potential threats early and implement control measures. Rapid response is essential for containing outbreaks and preventing them from becoming pandemics. The COVID-19 pandemic demonstrated the importance of rapid response and the devastating consequences of delayed action. The threat of emerging infectious diseases is constant. New pathogens are constantly evolving, and globalization facilitates their rapid spread. The history of plagues is a stark reminder of the power of microscopic organisms to shape human history. By understanding the science behind these historical events, we can better prepare for future outbreaks. We must invest in public health infrastructure, promote sanitation and hygiene, and support scientific research. Learn more about public health initiatives in your community. Educate yourself on disease prevention strategies. Support organizations working to combat infectious diseases globally. Your actions can make a difference in protecting yourself and your community from future pandemics. Like, comment, subscribe, and share